Did you know that approximately 1 in 10 adults struggle with toenail fungus? This common condition, also known as onychomycosis, extends beyond a mere aesthetic issue. It reflects an underlying fungal infection that requires attention and proper care. While discolored or thickened nails might signal fungal growth, these symptoms can also point to other conditions like toenail dystrophy. This distinction is crucial, as effective treatment hinges on accurate diagnosis. Beyond the discomfort it brings, untreated toenail fungus can lead to complications, especially for individuals with underlying health conditions like diabetes. The infection can spread to other toes, the surrounding skin, or even fingernails. In severe cases, it might cause pain while walking or increase the risk of secondary bacterial infections. Therefore, recognizing the signs early and seeking appropriate medical advice is paramount in managing toenail health. Section 2. Understanding the culprits. Toenail fungus versus dystrophy. Toenail fungus and toenail dystrophy, while sharing some visual similarities, are distinct conditions with different underlying causes. Toenail fungus, or onychomycosis, occurs when microscopic fungi infect the nail bed, the skin beneath the nail plate. These fungi thrive in warm, moist environments, making sweaty shoes and damp floors common culprits. Dystrophic toenails, on the other hand, refer to nail deformities caused by damage to the nail matrix, the area where the nail grows from. This damage can stem from various factors like injuries, underlying medical conditions, or even ill-fitting footwear. Section 3. Causes and risk factors. How these conditions develop. As mentioned earlier, toenail fungus thrives in warm, moist environments. Common sources of infection include public showers, swimming pools, and locker rooms. Wearing occlusive footwear that traps sweat can also create a breeding ground for fungi. Certain factors increase the risk of developing toenail fungus, such as age, where older adults are more susceptible due to slower nail growth and reduced blood flow to the extremities. Diabetes, where high blood sugar levels can impair immune function and make it harder for the body to fight off infections. And a weakened immune system, where conditions like HIV, AIDS, or medications that suppress the immune system increase susceptibility. Dystrophic toenails, however, arise from a different set of causes. Trauma to the nail, such as from dropping a heavy object or stubbing a toe, can damage the nail matrix and lead to deformities. Systemic diseases like psoriasis, eczema, and lichen planus can also manifest as nail changes. Nutritional deficiencies, particularly iron deficiency, can also contribute to nail dystrophy. Treating toenail issues effectively requires identifying the underlying cause. For toenail fungus, treatment options vary depending on the severity of the infection. Mild cases might respond well to over-the-counter antifungal creams or solutions applied directly to the affected nail. These products typically contain ingredients like clotrimazole or meconazole, which inhibit fungal growth. For more persistent or severe infections, doctors often prescribe oral antifungal medications like terbinafine or itraconazole. These medications work systemically to eliminate the fungus, but they require a longer treatment duration, often several months, and may have potential side effects. In contrast, treating dystrophic toenails focuses on addressing the underlying cause. If an injury is responsible, the nail might require time to grow out, and protecting it from further trauma is crucial. For systemic conditions, managing the underlying disease often improves nail health. In cases of nutritional deficiencies, dietary changes or supplements might be necessary. Preventing toenail issues involves a combination of hygiene practices and lifestyle choices. Here are some essential tips to keep in mind. Keep feet clean and dry. Wash your feet daily with soap and water, ensuring you dry them thoroughly, especially between the toes. Choose breathable footwear. Opt for shoes made of natural materials like leather or canvas, allowing your feet to breathe. Avoid wearing the same shoes every day, giving them time to air out. Wear shower shoes. Protect your feet from fungal exposure in public showers, locker rooms, and pool areas by wearing flip-flops or shower shoes. Trim nails straight across. Avoid cutting nails too short or rounding the edges, as this can increase the risk of ingrown toenails. Moisturize regularly. Keep toenails and surrounding skin hydrated with a moisturizer, but avoid applying lotion between the toes, as it can trap moisture. By incorporating these preventive measures into your routine, you can significantly reduce the likelihood of developing toenail fungus or other nail issues. Early detection and treatment are crucial in managing toenail issues effectively. If you notice any changes in your toenails, such as discoloration, thickening, or separation from the nail bed, it's essential to consult a dermatologist or podiatrist for proper diagnosis and treatment. Self-treating can be ineffective and might worsen the condition. Your doctor will examine your nails, inquire about your medical history, and might take a small sample of the affected nail for laboratory analysis to confirm the diagnosis. Based on the findings, they will recommend the most appropriate treatment plan for your specific needs. Maintaining good foot hygiene, wearing appropriate footwear, and seeking timely medical advice are essential steps in ensuring healthy toenails. Remember, prevention is always better than cure.